For those of you unfamiliar with my work, I want to give you a hopeful note about where medicine may be heading in the future. When I was in my pre-medical studies at the University of Illinois down in Champaign-Urbana, I minored in astronomy, and I learned a lot about black holes, and the actual physics behind them are not as relevant to our discussion today. But the black hole has become a symbol for just a complete void, an energy-sucking entity that doesn't nourish the things and people around it, kind of swallows it up. And without being too harsh, and certainly no disrespect meant for my medical colleagues, this seems to be an area in medical education that winds up a complete cipher. You ask your doctor about what should I be eating for this condition or that condition, and kind of a blank stare appears. And most doctors' understanding of nutrition and the role that their patients' daily diet plays in creating and maintaining their diseases is kind of a black hole to them. And they say, listen, I never learned about nutrition in med school. No one really mentioned it seriously. There aren't any studies that says it makes a difference in any way. I don't have time to do nutritional counseling. I got a waiting room full of patients. I don't get paid for nutritional counseling. And besides, people are never going to change what they eat. They love their Big Macs and their pizzas. And people's food choices are cultural, and I can't change that. And besides, I like cheeseburgers and sausage pizza myself, but I take statins, so I'm protected. So it really doesn't matter. Send the patient to a dietitian. Don't bother me. I'm up in the operating room doing real medicine. And this is kind of the barrier that patients and nutritionally aware physicians run into when they talk to their colleagues about this subject. And then when you ask the doctors, by the way, you're treating my high blood pressure, you're treating my diabetes, do you think these are reversible? Any chance I could not have high blood pressure the rest of my life? How about diabetes? Any chance I could get off my insulin? Oh, the vast majority of doctors will roll their eyes and say, listen, these diseases are relentlessly progressive. They just get worse. Nothing can reverse these diseases. We can just give you more and more powerful medicine. And I hope you don't have your stroke when I'm on call, but they don't say that. No, you get no real encouragement that you can ever get out from under these diagnoses, which is really sad, because I'll tell you why in a few minutes there. But with this stance that these are relentlessly progressive diseases and nothing can reverse them, and that's right, doctor, if you don't change the patient's diet or help them change, that is what you're going to see. Now, I hear this cynical, well, they're all getting fatter and sicker, they all need stents. That's right, doctor, if you don't help them change their diet, that is what you're going to see. But with that stance, the patient's health certainly suffers as these diseases progress. The patient's satisfaction with medicine, the physician's satisfaction with medicine wanes. They dread coming into clinic another day dealing with these folks who aren't changing, and they're just getting worse in their clinical condition. And our society pays for the stance. Trillions of dollars go down the black hole, if you will, of healthcare, where you do these $1 million bypasses on folks so they can go out and eat more cheeseburgers and buffalo wings and come in with their grafts clogged up. This is just cost society and money and lost productivity. It doesn't have to be like this. And the question I'm asking after 50 years in clinical medicine, what will it take to create a new generation of nutritionally aware physicians and dentists and nurses and physiotherapists, podiatrists, pharmacists, all health professionals need to have an awareness that what their patients are eating is the chief reason they're sitting in front of us, overweight, diabetic, hypertensive, clogged up, and inflamed. What will it take? As much as I was hoping that a tsunami of awareness would sweep through my beloved profession, indeed, that has not happened. So like so many things in life, if you really want something to happen, then strap it on and work to get it done yourself. So to that end, we have established our Moving Medicine Forward initiative. And from 2017 to 2020, I was going to dozens and dozens of medical schools across North America, Canada, Mexico, Australia, New Zealand, Europe. And giving those first, second, third year medical students the lecture I wish somebody had given me 50 years ago, before pharmacosclerosis set in my brain, and these young students thinking that drugs and surgery are the only treatment for diseases. And I tell the med students, look, in med school, in pathology class, physical diagnosis, you are going to be learning how to diagnose all sorts of weird and wonderful diseases, from smallpox to leprosy. But when you get out in the real world and you open the door of the waiting room in your own medical clinic or in the emergency department, surgical outpatient, the people who are going to be sitting there are not going to have smallpox or leprosy, thank heavens. Now, what you're going to be seeing is a large group of people with a small group of diseases. The majority of them are going to be overweight, if not clinically obese. You're going to see rampant clogged arteries and atherosclerotic vascular disease showing up as elevated lipids, elevated blood pressures leading to strokes and kidney failure. You'll see florid type 2 diabetes in so many of your patients, and a host of inflammatory diseases affecting every organ system, lungs, gut, joints, skin. This is Western medicine in the 21st century. This is this small group of degenerative diseases that are going to take up the vast majority of every physician's time throughout their career, whether they're in surgery, internal medicine, pediatrics, pathology, respiratory, GI. They're all looking at new diseases that have the standard American diet as the fundamental disrupting cause. It's not the only issue. There are infections, et cetera. But our current Western diet certainly makes all these conditions worse, if not drives them to a fatal outcome. And yet, when you look in the textbook or ask the professors, what's the cause of these diseases? You run into a thicket of biochemical mechanisms of this gene calling for that enzyme and this enzyme inhibitor dependent upon this mineral. And you wind up throwing up your hands and say, nobody really understands these diseases, etiology unknown. When the smart men and women work in those labs 24/7, figure it all out, they'll come up with a mesocillin, and I'll be able to give it to my patients, and they'll be magically restored to health. Till then, I'm happy just to keep their blood pressure under control, their blood sugars under control by raising their insulin dosage, et cetera. This has become Western medicine in the 21st century. And that really disempowers both the patient and the doctor, because if you don't know the real cause of the disease you're trying to treat, then you can't really cure it. You're kind of just managing. Now, we'll manage your high blood pressure, you manage your diabetes. Well, that's not very satisfying kind of medicine. You're just going to watch the patients get steadily worse. And the very act of practicing that kind of medicine, you see this never-ending river of patients in the clinic, and you just wind up raising their insulin dosage, raising their statin dosage, raising their beta blocker dosage. So you ought to lose some weight, Joe. Come back in a month. Let's see how you're doing. If this is the kind of medicine the doctors have practiced, they're going to leave medicine. It's so dismal because the very act of just giving the patient that prescription for the beta blocker or the higher insulin dosage is giving them a message. It's saying, you're going to be sick the rest of your life. You'll always be diabetic. You'll always have hypertension. You are never going to get better. The best we can do is manage your disease. You will now have the rest of your life. What a dismal message to give the patient. What a hopeless way to practice medicine. And it really is such an unnecessary approach altogether, because the reality is that every one of these deadly degenerative diseases are to a greater or less extent reversible. Every one of us who practices a lifestyle medicine and gets these folks on a really healthy, whole food, plant-based diet, cleans up their lifestyle practices, enough sleep, less stress, et cetera, we all see these diseases reverse. They go away. How exciting that you can help these patients truly become healthier. Etiology unknown, really? Let's look at what our patients are eating. We've become a fast food nation in the past 50 years.